this started. I'm Joe Medeiros, and this is our final intellectual salon of the year. I thank you very much for coming to participate, and for those of you who are using the coffee shop for its primary purpose, we're a coffee shop and talk and have fun. We appreciate your patience in this. We want you to enjoy yourself. Make sure that you keep supporting the business over here and get your coffee and come in and sit and relax. This is our final intellectual salon for the semester. We've been doing this now for a year, talking about home and all the different aspects of home, especially refugeeism around the world, migration, and we're ending up with a very, very important local issue. So we've kind of gone globally and narrowed it down to a local issue. And why are people without a home? Why are they homeless? We've talked about so many different reasons that refugees flee their homes or can't go back to their homes. And so this is an important issue, a very, very important global and local issue. And we appreciate your coming out today. We've invited our salons are a combined effort between the library, the Friends of the Library, the Sierra College Press, and the Associated Students. And we like doing these things. We will do them each semester, and we welcome you to join us next semester as well if you haven't graduated and moved on from here. This is a very important issue, and I've invited the Director of Health and Human Services, Jeff Brown, to present, as well as Kathy Denton, who's the manager of the Homeless Service Program. So they'll go back and forth. We've got a little bit of a presentation first to lay the groundwork for this very important issue, and then we'll open it up to questions and question and answers. And thank you both so much for coming today and sharing this reality of humanity in Placer County. Thanks, Jeff.
Great, thank you. So it's a great pleasure to be here. I was quite pleasantly surprised to see this connected to the larger issue around refugees. Just as a point of reference, I started 30 years ago working as a refugee worker over in Africa, and I met my wife in Africa working as a refugee worker, and so spent a lot of time working with displaced people. Think of refugees as externally displaced. These are our internally displaced individuals. So we're going to take about 25 minutes, Kathy and I. We're going to go back and forth and talk a little bit about national numbers. We'll share what our local numbers look like. We'll share what we do locally to address this issue, and then just open it up for any type of dialogue you'd like to have. And so, the big question is, why are people homeless in America? And Kathy will go over some individual factors when we look at a profile for Placer County from our last homeless point in time count. But you can see, number one, for us, it starts with housing, major issue in California, but it's an issue around the United States. Can start with learning disabilities. That relates to your ability to ultimately become employable and hold work. Chronic substance abuse is a major issue across the United States with the population that we work with, particularly for people that are chronically homeless. Mental illness is a major factor, and that's one of the subpopulations that we particularly target in Health and Human Services in Placer County. And then you can go down the list, people with HIV and AIDS, people that have been in our foster care system and have not really successfully graduated out of that system. Domestic violence is a major issue, and then I previously mentioned work skills. So to put it in perspective, these are numbers from 2018, but on any given night, about 500,000 people across the United States. So you might ask, well, how many people are homeless in any given year? Well, it could be 2, 3, 4 times that number. Every time we get someone out of homelessness, we've got other people coming in due to issues with their environment and with their personal circumstances. Actually, since 2017, a nationwide decline. Seems much worse, particularly in California, but nationwide, a decline. And you can see just from 2017-18, there was a slight decline in California, while a slight increase. So these are incremental numbers right now. And then I think the number one at the bottom is California has 24% of all the homeless, and with 69% unsheltered. So one thing you really see when you compare to East Coast states like New York, they're able to shelter on any given night 2/3 or more of their population. They've really put an investment in shelter care. In California, any given night, over 2/3 of our homeless are living on the street. And then just comparing to other states, you can see New York's not far behind us, Florida, Texas, Washington, all big numbers. And you know, most of the numbers in Washington happen to be in King County, the Seattle area. It has one of the larger concentrations in the United States. And so this is rates. So you think we have so many people, but we have a lot of general population in California, being the largest state, almost 40 million people. And you can see, you know, per capita, New York has 1/3 more than California has, although the numbers are still significant. So what's happening in Placer County? Well, I know Kathy and I work on a daily basis with individuals in the community that think we're being overwhelmed by homeless people. And the fact is our numbers have been relatively stable for the past decade. On any given night, when we go out and do a homeless count, it's roughly about 600 individuals. Now that doesn't compared to other cities in California. Other cities in California see big, big numbers. And this is a slide I just wanted to show to give you kind of a relative comparison, but our numbers in Placer, I don't even have Placer on that list, but do I have Placer at the very top, bolded out. But you can see that in 2017 we counted 663, which is more than we counted this year. Kathy's going to share that information with you. But 17 per 10,000 residents. You can see, go next door to El Dorado County and they have almost double that. And if you drop down and just look at some of the numbers, look at Los Angeles, almost every other homeless person in California lives in Los Angeles. It is the largest concentration of homeless people in the United States, next to New York City, and then you move, believe it or not, to San Diego, which has about 8,500 homeless individuals, and then you move over to Seattle. So big, big numbers, and I'm going to shift this off to Kathy to start talking about what our latest count was.
The mic is actually only for the camera, so I will talk loud, hopefully. So we do a homeless count at the end of January every other year for HUD. We, as Placer County, have decided that we want to do a homeless count every year. So we get an idea of what our trends are, what our services that we need to put in place. And this year was our big homeless count. That means that you do a sheltered and an unsheltered count for HUD every other year. It was both a sheltered and unsheltered. To give you kind of an idea how that takes place is that we have trained caseworkers that are going out with law enforcement agencies. We go out as teams. We blanket from one end of the county to the other. I'm going to show you some maps here in a minute of how long our county is. But this year we found that we had 617 individuals in Placer County that were homeless. It indicated that 65% of the population are male, 35% female. We had 12% that were children under the age of 18. Adults over the age of 60, 16%. You can kind of see. I wanted to stop here at chronically homeless, that 46% number. Chronically homeless means an individual who has been consistently homeless for a year or have had 4 episodes of homelessness in the last 3 years. Very important distinction, because a lot of the funding that we're able to apply for these days are for chronically homeless. That's our goal, is to decrease the number of chronically homeless that we have. Other adults that were of interest, 13%, domestic violence, stalking, sex trafficking victims. These were people who were currently fleeing those type of situations. And then we had a percentage of 9 for our veterans. Kind of looking at our special populations, 40% had serious mental illness, 28% substance abuse, 21% lived in foster care or group homes sometime previous in their life. 75% lived in Placer County at least a year prior to becoming homeless. There's been a myth out there for years that people are just coming to Placer County, but they're actually homegrown individuals that are homeless in Placer. As I mentioned, so this is a map of Placer County. This year we were able to use a mobile app, and that mobile app we did our survey on, and then we GIS'd where we were taking that survey. And all in one morning, we were throughout the county counting folks. So we had a hub in Roseville, a hub in Auburn, and then we had a meeting place up in Tahoe, because they're quite a bit smaller than us. And those hubs provided where the teams went out from, and it also provided where we did a special event to try to engage homeless to come in and get counted. Kind of incentivizing for them to participate so that we could get the information that we need in order to develop the services that they need to move out of homelessness. So that's all of Placer County. These are our concentrations. One of the reasons you'll see kind of a big red dot both for Roseville and for Auburn is because those are where we have our shelters and we count our most folks. It's where we had our hubs, where we invited homeless to come in and have a light lunch, hot dogs and hamburgers. So this is our, we divided up into three parts, as I said. We had South Placer, Mid Placer, and then the Tahoe area where we counted. We also counted at the same time as Nevada County, because Nevada is part of our continuum of care. So Nevada, up in the Tahoe area, we kind of share some of the areas in the Truckee area. So they had the most of the count up in the Truckee.
Straight off?
Yep.
Somewhere. So I think sometimes the question comes up, this is a major societal problem. Who should be responsible for fixing it? Why is it such a mess? And whoever's responsible, they're not doing their job. And I just point out that there's no statutory requirement for counties or cities to explicitly serve homeless individuals. And so what does that mean? Not necessarily a bad thing, but it really means if we're going to have results, it's really going to take everybody at the table working together. So cities need to work with counties, need to work with the business sector, need to work with residents. And I mean, when I say need to work with residents, it can be everything from supporting your local nonprofit to when people try to find a site to build permanent housing or find a site to place a shelter, at some level, we need people to support it because we just can't keep pushing the problem off to an adjacent area. I mean, they are struggling with their own issues. Typically, if you look around the United States, counties provide services. We provide the substance use disorder treatment services. If we don't provide them directly, we fund them. We provide a lot of the mental health services for people that are seriously mentally ill. We actually run the equivalent of a managed care plan for people that are seriously mentally ill on Medi-Cal. And we have the responsibility to serve everybody within the county. And the last piece I have is we actually have a coordinating body within Placer County. It's a nonprofit. It's made up of leaders from the nonprofit sector and government that actually try to come together, identify gaps, and try to come up with plans to better serve the population across the county. So typically, Health and Human Services. We are a department in Placer County. We're the largest department. We're larger than the sheriff. We have about 800 employees. We have a $200 million a year budget. And we have some resources to bring to the table. So we're in charge of public assistance. So that can be, there's a program for single indigent adults called General Relief. We sign people up and provide that benefit. CalWorks are for parents with children that are low income. SSI, SSDI, those are Social Security programs for people that are disabled. We also have some food assistance we provide. CalFresh, which used to be known as food stamps, our WIC program. We are involved in providing shelter. There's actually 2 housing authorities in Placer County. There's one in the city of Roseville that covers Roseville and part of Rocklin. And then for the rest of the county, our department actually runs the Placer County Housing Authority. What do we have? We have what they call Section 8 vouchers, which essentially are given to individuals that are low income and or disabled, and it essentially reduces the cost of rent. It's a rent supplement program. And we also have some vouchers that we provide to veterans that are formerly homeless. We have some transitional housing programs in the county. You see the term there called permanent housing grants. We have permanent supportive housing, which is when we put individuals in housing, but we provide services to them. These could be people that are seriously mentally ill that really aren't quite sufficiently in recovery to live by themselves 24/7 all week long. So we'll check in with them, we'll help them with their medication, we'll help them with shopping. We do whatever it takes to try to keep them stable, keep them in the community, and keep them at a level where they can contribute as best they can. We have Mental Health Services Act dollars, that's some of the housing I was talking about, financial support to nonprofit shelters. We have 2 shelters in Placer County. You have the Gathering Inn in Roseville, Rocklin area that is called a nomadic model, where people show up in the afternoon and they essentially take a bus to a different church sanctuary every night, and they're fed a meal, allowed to spend the night, get back on the bus, go back to a day center. So that's kind of a rotating model. They go to a different sanctuary every night. And then we have a fixed site location in Auburn at the Placer County Government Center, the DeWitt Center. And together, those 2 programs are both run by the Gathering Inn. They serve on any given night 165 individuals, and they're almost always full. Not huge waiting lines, but almost always full every night. And then medical care, very, very important. Medi-Cal. In our county, we have 70,000 individuals that receive their health insurance through Medi-Cal. And so Medi-Cal opens up the doors to lots of treatment options, not just primary care, but also mental health and also substance use disorder treatment. So that's a really important program we try to get everybody signed up on. And for those that don't qualify for Medi-Cal, we have another local county program, although with the recent expansion of the Affordable Care Act, almost everybody qualifies for Medi-Cal. Did I click one too many? So we provide the behavioral health services throughout the county. We've got and alcohol and drug services are part of that, not just mental health. We also have the Veterans Services Office that sits within our department. And we try to work with veterans and try to determine what types of assistance they might need and try to help them apply for it. So it could be everything from education assistance to housing assistance to medical assistance. I skipped over net. Let's see. Okay. Public protection, other partnerships. We also work with the sheriff. We work with probation. We work with local police departments. We actually have outreach workers, mental health workers, go out with probation officers and go out with either police officers or sheriff's deputies to do outreach to people that are homeless. The whole goal there is not to be punitive. It's to try to get them into a system of care and ultimately keep them from ending up in the jail, ending up in the hospital, or ending up in a psychiatric hospital. And then we also work with probation. Probation has some reentry programs around the county where they provide extensive services to people either coming out of jail or out of the state system, and we work with some of the treatment services. And then housing. You know, I mentioned what are the reasons people are homeless? Well, number one, it's housing. There is just not affordable housing in California. And so one thing we've gotten involved in, which has not been very typical as a Health and Human Services Department, we've started to get in the housing business. We're actually buying units and turning them over to nonprofit agencies to run so that we have homes and bedrooms to place people into. So one of our partners is the Roseville Housing Authority. As I mentioned, we have a housing authority, and then we have supportive housing. One of the nonprofits we work with is Advocates for Mentally Ill Housing. And then we also, Project Go has some affordable housing in the region, and we work with them. And I'm going to let Kathy talk about the 10-year plan.
Since 2004, we have done homeless plans. You know, our first 10-year plan to end homeless had some goals, and we met these goals by different measurements, up and down. You know, some were smaller achievements, other were larger achievements. Every time there's an opportunity to apply for grants, we want to apply for them. We want to, because that's what brings services to our community. So homeless prevention and rapid rehousing program, those are programs that are designed to prevent people from becoming homeless. They have an eviction. We want to help them with the resources that are going to prevent them from becoming homeless in the first place. Rapid rehousing is that opportunity when somebody becomes homeless, that we immediately get them back into housing. Because the longer somebody stays homeless, the harder it is to get them back into housing. We applied for more housing choice vouchers specifically for veterans. You might have heard of it. It's called HUD-VASH. Permanent housing through public and private partnerships. Again, as Jeff mentioned, our MHSA housing with the Advocates for the Mentally Ill, working with nonprofits that are able to take and own that property and then be a resource to us as county services to have places for our people to go. We increased the beds at the Gathering Inn. Years ago, the Gathering Inn was just a concept that started in a room with about 25 pastors. They decided they wanted to address the issue of homelessness in Placer County, and they came up with the plan of a nomadic shelter, and out of that developed the Gathering Inn. Stand Up Placer and Tahoe Safe Alliance are for our DV victims. They provide transitional housing, so we increased those beds. We added more beds to the shelter and built a shelter up in Auburn for domestic violence. Those safety net services, CalFresh and Medi-Cal, we increased the number and availability to our community members. Discharge options for local institution. We needed to have resources for our folks who are coming out of jails, coming out of psychiatric hospitals. So we increased what those services would look like. Homeless Management Information System, otherwise known as the HMIS, that is a system that we use to track the services that we provide to homeless in Placer County. And through the year, you know, we started 10 years ago with an access database, and now we have a system that is county-wide. So also within that first year, we increased our 10 years. That first 10 years was our employment services. We expanded both our mental health and substance abuse services in the county. We have a much better working relationship with our city partners, particularly the city of Roseville. We've done a number of joint ventures. Our creation, as Jeff mentioned, of our homeless outreach teams. Every opportunity there is, both state and federal, we go after those that fit our needs to provide more services in our community. And then we developed a continuum of care with Nevada County. We joined as a continuum of care to apply for HUD grants. You know, this gave opportunities for both of our counties to have better applications when we were applying for HUD funding. In 2014-15, the Board of Supervisors approved for Health and Human Services to contract with Marbic Consulting. He did another Placer County needs assessment for us. He mapped out our continuum of services that we have available. He identified where some of our gaps were in our system and what we needed to do different. He identified key populations. You know, again, our chronically homeless was one of the populations he pointed out because our number was much higher than the nationwide number. So gave us ideas of what we needed to do. He made recommendations. He said that we needed to have 24/7 shelters, and we needed to have them throughout our county, not just in one location, so that they were more accessible for folks. He said we needed to improve our HMIS system. You know, we needed to have every provider in Placer County who's providing homeless services utilizing HMIS so that we could all see what each other is doing. And it was the improvement of our data through HMIS that helps us along the the pathways of getting more grants to bring into the community. So we've done some new initiatives within the last few years. MHSA Housing Main Street particularly is 18 units in the city of Roseville. We purchased a 100-year-old building, and as you can imagine, had to do some renovations, but it provided us with 18 new units. It wasn't being utilized fully. Sutter Health Foundation gave our whole person care funds so that we could, is this our old or new? Actually, they've given us 2 rounds of funding. And the first round of funding, we purchased 2 houses that provide permanent supportive housing. And that we do group living. Individuals will have their own room, but they share all the common spaces. It's been very effective in regard with individuals who have SMI, severe mental illness. We expanded our board and care capacity, another great need that we have in Placer County. We need more board and cares. We are currently in a project with the city of Roseville with Meta Housing, downtown Roseville, to build 78 new units, which 10 of those units will be particular to our folks with SMI. And it's breaking ground May 21st, so you'll see lots more advertisement of that coming about. Mercy Housing, No Place Like Home, we're building 79 brand new units up at the DeWitt Center. And that will be affordable housing. It will be a mix of housing, but 20 of those units will be set aside for our folks who are receiving mental health services. And it actually will be the first project that we've used our project-based Section 8. We're going to have 20 vouchers that will subsidize that program. Again, it's the stepping stone to doing it more often to make more affordable housing in Placer County. Other initiatives that we have a CalWorks housing support program. Though that program is for families that are eligible for CalWorks. They get assistance to maintain their housing, get them back into housing. Again, we contract with a nonprofit to provide that service. HomeSafe is a brand new grant that will start in the next month for our senior citizens. It is to help prevent them from homelessness and to get them rapidly rehoused for those folks who are connected with our adult protective services. Housing coordinators. We did a pilot about 2 years ago to see if we added housing coordinators to our continuum, would that make a difference? These housing coordinators divide up the county and they're providing services, direct services to those people seeking housing. You know, this is what you need to do to get into housing. They have a checklist. They provide ready to rent classes. It's becoming an evidence-based model of what you need to do to be a good tenant. And so they do footwork. They're out there also engaging with our landlords. We need a pool of landlords that are receptive to the folks that we're working with. So every day they're knocking on doors to tell people about our programs and what the benefit is to be a landlord for one of our programs. Built for Zero is an initiative that is nationwide. I don't know if you might have heard of 100,000 homes. Well, it's the same group, Community Solutions, that is doing the Built for Zero initiative. And the initiative is to end functional homelessness for veterans and chronically homeless individuals. And they actually have several communities that have achieved this. So they've actually ended veterans' homelessness in their communities. So the initiative takes your data, takes your information, provides you with the resources of the nations of what the best practices are, and moves you forward in what you're doing in your community to end homelessness. Other new initiatives, we've added limited homeless preference vouchers in our Section 8 program, Housing Choice. We've expanded our outreach efforts to identify both and serve homeless military veterans. You know, out of our system we had to develop a coordinated entry. Coordinated entry is a 1-point entry point in regards to getting on a permanent supportive housing list and to get into our shelters. You can't get into the Gathering Inn unless you call our 1-8333 placer number in order to get into the shelter. And there's a few resources that we've started with for that program, but coordinated entry again develops what we call is a by name list. And what I'm leading to is that now we've taken that by name list and identified every homeless veteran in Placer County, and we've made a concerted effort that somebody is outreaching to those individuals to help them find housing. New mainstream vouchers, we have 14 for both, these are for non-elderly disabled population, and therefore we have 14 for both the Placer County and for the city of Roseville. It just adds to the pool of housing vouchers that we have available. Is still me? Oh my goodness. Other homeless, as we were putting this together, I just kept thinking of more and more things that we have been doing. And it's just amazing that Placer County has the resources that it does. Our homeless liaison team, Jeff talked about, we've done that, but we've also, the city of Roseville said, you know what? Can you help us with one of those? We've been approached by the city of Auburn. You know, can we look at having a mental health worker go out with our law enforcement? So you start with one little initiative and it kind of expands. Mental health services, we expanded in Auburn. Drug medical services have expanded here recently. We've expanded our SSI application assistance. We actually have a SOAR program that helps individuals with their SSI. What's the number one thing you need if you're going to go into housing? You have to have some money. So getting our disabled folks eligible for SSI has been very beneficial. We have a homeless mentally ill grant that actually, outreach grant that actually assists where no other funds are available. You know, we have resources for people who qualify for our MHSA program. This program actually helps those folks that have a mental health condition that aren't covered anywhere else. It helps with transportation, housing resources, you know, down to the basic needs that individuals might have. Roseville County Shared Outreach, we talked about that. We have 6 medical respite beds through our whole person care program. When people are being discharged from the hospital, if you're homeless, going out on the streets isn't always the best option, so they can actually go to our medical respite program, get back in shape before, you know, get some stability under them. And that's, again, through whole person care is another pilot program. I think Jeff's going to talk a bit about that more.
So, you know, people ask what works well with addressing people that are homeless. There's been a number of pilots over the past few years, but what really works is really trying to provide intensive services, coordination of services, and housing to individuals. And we were fortunate enough, there was a pilot program that the state put forward for millions of dollars to be able to test the concept. If you could put a level of intensive services to people that are, we used to call them frequent flyers, but you can call them high utilizers of service. These are people that go in and out of the jail, go in and out of the emergency room at both Sutter and Auburn Sutter hospitals, or go in and out of our psychiatric health facility. We run a psychiatric hospital in Roseville, 16 beds, and people that just constantly rotate in and out. And the whole premise is if we can provide more supportive services up front and pay for the housing, maybe we can actually have better outcomes in terms of quality of life, but maybe we can actually even save some money. And so we were actually the first pilot that was funded in the Sacramento region, and again, to really target over time about 450 individuals. We've been in operation roughly a couple of years. And 4 major components, really outreach and engagement with individuals. I will say that we originally thought maybe 1 out of every 3 people would be interested in enrolling in this pilot. But the pilot ended up getting a reputation on the street that if you participated, you'd get housed. And all of a sudden now, almost everybody we talk with, they want in. You know, that's really what they're looking for, is some type of stable housing. Intensive care coordination, in addition to that, housing coordination, really helping people learn how to work with landlords, how to pull together a rental resume, for us, how to outreach to landlords and try to make it appealing for this program so they'd be willing to rent to some of our individuals. Because they don't have great rental resumes. They have evictions, and they have other issues that don't make them primary candidates. And then medical respite, Kathy was talking about that. I mean, really difficult. When you're discharged from the hospital, still have a medical condition, to try to heal on the street is almost impossible. Great benefit for the hospitals to have a program like this because, you know, we can keep people from re-entering that emergency room and put them in a supportive house where a nurse will check on them every day. And we don't discharge them, you know, within a week. We discharge them usually within a month or so. So this just talks about some of the intersections there between behavioral health corrections and the medical care system that we're trying to address and get out of silos and really try to treat people in a more holistic manner. And then this is one of my last slides, but I'll say outcomes. So we've worked with about 240 individuals. We've housed 100 people. And when I say we've housed 100 people, they're permanently housed. Every time someone can't be fully stable in housing and they end up becoming homeless again, that number goes down. And so we just crossed that 100-person barrier just a few weeks ago. We actually celebrated. And you know, our goal is to probably double those numbers within the next couple of years. To do that, we need housing placements, and that's why we're using every spare dollar we have to go out and buy housing. And then I just say we have some numbers there. We've seen significant reductions in both emergency room use and inpatient hospitalization. We're actually seeing lower rates of psychiatric inpatient use also. And the state, or the California State Association of Counties, they give out a couple of challenge awards every year. And last year in 2018, they recognized this program as one of the better ones in California. And so the only thing I'll say is, you know, I don't think there is any one solution to homelessness. And people, you know, many years ago, we had something that was entitled the 10-year plan to end homelessness. So 10 years started in 2004. We hit 2014. Everyone said, you're a failure. You didn't end homelessness in 10 years. And I don't look at homelessness as something we're going to end here in the short period of time. You know, this is really, homelessness is like the perfect intersection of all major social issues. You know, you think about domestic violence, you think about unemployment, you think about lack of affordable housing, mental illness, substance abuse, all wrapped into one. It's a really tough issue, but I think what we've shown is if you can wisely invest your dollars, we can make a difference, and that's our goal here. So, you know, ultimately we'd love to see it ended, but I know the public in the last 5 years or so has really been frustrated with some of the negative impacts of homelessness in the community. But I think also the public is probably willing to make investments if they believe they're going to have some positive, you know, outcomes. And so I'm going to stop right there and leave it open for any questions for myself or Kathy or any type of dialogue you'd like to engage in.
Before we start into that, I wanted to, Hayden, where did you go? Did you disappear for a second? We have EOPS and TRIO. We got information right here for, can you read that, turn that sign around for me, that little placard so I can read it? Interested in priority registration, assistance with books and more. As you know, as you've heard, there's a tremendous amount of assistance for people outside of our campus, but there's also a tremendous amount of assistance within our campus as well.
Can I add one thing?
Yeah, please.
So about a week ago, we actually had a meeting here on campus with a number of individuals that are really concerned about homelessness. They're concerned about a lot of students that are sleeping in their vehicles at night. And there's actually, I believe it's an assembly bill in the state legislature, either that or a Senate bill, to actually require community colleges to provide safe sleeping parking lots that would have sanitary facilities and a guard. And that's moving its way through the legislature. I'm not sure that's going to be successful or not, but it's certainly going to be seriously considered. But what we found out, you know, we want to better coordinate what we do within government with what's happening here at the college to really try to identify students that need help and try to get them whatever assistance we can provide. And I will say, you know, we have a lot more assistance if you're a veteran. We have more assistance if you came through our foster care system. We have more assistance if you have kids, if you have a family and you're associated with CalWorks. But the majority of students don't fit in those three categories, and it makes it very difficult. But so we didn't find any magical solutions when we met, but I think it's something we're going to be offering some classes here, short-term classes around. We have a class called Ready to Rent.
Ready to rent, getting started, what do you need to do to get into housing, kind of those things they teach you in Ready to Rent. But we do a once-a-week meeting where people can bring their housing challenge and a caseworker goes through it with them. These are the things you need to do that we're going to help you get into housing.
And that's important for a lot of students, I'm sure. Hayden, I announced you were absent just for one second, yeah. So Hayden's here to answer questions about numerous programs on campus as well. So that was a quick tour through a great deal of information. And I'm sure that you have questions. I've got plenty, but let's hear yours. Let's hear yours first. Mark?
I just read in the paper that in terms of college students, 1 in 4 community college student reports being homeless within the last year. And so you did briefly address that that's kind of a concern, but is there anything that's out there for our homeless college students that aren't CalWorks, that aren't veterans, that don't have mental health? They're just regular people that don't make a lot of money and they're trying to go to school.
Well, if you're not low income, quite frankly, the county doesn't have many programs to work with you. I mean, I think a major issue is just really housing. And how do you find some type of individual housing or shared housing that you can afford so you can get out of your car or get off of somebody's couch? But it's a big gap. No magic solutions right now for that population. Incredibly frustrating.
And anyone over 18 can use the Auburn shelter as a resource. They have a program there. If down here in the nomadic program, it is for families and for individuals. If people wanted to come in for a night, get cleaned up, and have a safe place to stay. It takes a lot of energy to stay safe at night.
If someone was willing to go in and take advantage of the shelter in Auburn, the day you go in, they start working with you on an exit plan. So they're going to work with individuals individually and try to identify what they might qualify for, where they might have social connections, and try to work with them, because the shelter's really set up. They don't want people there for over 90 days. They're really trying to find more permanent solutions, but they would assign someone to work with you to try to explore whatever options are available. But if you're a student trying to go to college, Auburn's not always that convenient, if you're going to school down here in Rocklin and trying to, if you don't have personal transport, public transport has its challenges.
Yeah. So go ahead, Em.
What are the intake times at the two centers, the gathering in?
So I have some cards. If
Okay.
you call this number, intake time they have flexibility just depending on what their availability is. So you call the number and they'll give you a referral. If they have openings, they'll take you in. We have started an overflow process at the Auburn shelter, meaning that there are people that are there in their program and they have approved nights out that they're staying with family or something, and that opens up a bed for somebody for a night. It gives an opportunity to get introduced to the shelter, come in, get cleaned, and a meal, get cleaned up and have a meal and such. So there's just different opportunities, but the way you get into the shelter is that you have to call the 1-883 Placer number. I have brought plenty of cards for that.
Your green ribbon.
My green ribbon. May is Mental Health Awareness Month, taking care of our minds as well as our bodies. So on May 21st, we'll also have a walk up at DeWitt where we go around, everybody's dressed in lime green. So this is an initiative that happens every year in May, making people aware of taking care of their mental health as well. And so each Mind Manor sponsors it. So I'll leave some of these up there too. Show your support. Wear a ribbon for the whole month of May. Sometimes I wear mine all year round. Other questions?
Right behind you.
Yes.
You made a mention about the students that are sitting in their car. I'm one of the seniors here, and I came back to school to transfer to a master's program. But I am a hospice worker and wasn't for the college year in the ARC with my learning disability when I've gone through school this far. But you know, they're poor. I mean, they wouldn't be sitting in their car if they had money. And I've been trained as a property manager. I trained managers for 40 years. And I worked 3 jobs, and it was like I always, in every apartment complex, 100 or less, or we had, that we always had mental health openings for them. I'd make sure that they would be, our managers were trained, and they would help them. I would work with the mental health department, you know, they would come and work with them. And I think it takes awareness, but I was raised with a schizophrenic mother and a bipolar husband. So because of all those years and all kinds of stuff, I learned that these choices, they have a chemical problem, they have a broken brain, they can't always make the right choice, but we can. We can if we're educated. Thank you.
Yeah, thank you.
My question is, has it been determined that there are some individuals who actually not necessarily are chronically homeless, but prefer to be homeless, that they actually find in their lives a real interest in just being homeless and enjoying it?
Well, I don't know about enjoying it, but there are some people that don't want to go into shelters. They've had previous experiences. I think for people that have been outside camping for the last 10 years, feels very confined to go into a shelter, and especially given whatever type of mental health issues they may be dealing with. And you know, I think of people, particularly with serious mental illness, a huge number of people with serious mental illness do not believe they're seriously mentally ill. So they're treatment resistant. And so, yeah, we run into those individuals all the time. And so when we, as I mentioned, when we designed our whole person care pilot, we estimated only 1 out of every 3 would be willing to work with us over the long haul. We've had much better success than that, but we don't have 100% success. But I think the numbers of people that, you know, that don't really want to engage and don't want to come off the street, I think those are lower numbers. I think sometimes people think those numbers are the majority, and in our experience, it's the minority. It's a smaller number.
Way less than 10%. Years ago, the number used to be 10%. And what happens is as people get older, their ability to stay out gets harder to do. And then, so what we find is a number of those chronic homeless people are up in age. I mean, we have people as old as 90 that are out on the street. And so you imagine.
Now, that's our fastest growing percentage of population of homeless are the elderly. We never used to see people over 60. Why didn't we see people over 60? Well, usually if you're chronically homeless, you usually die before you hit the age of 60. Because you could be chronic alcoholic, usually other drug and alcohol issues. It can be very violent to live on the street. And so people didn't live that long. But now we're seeing a new phenomenon as we start to age and people just don't have the level of resources. And then you take a state like California where housing is so expensive, and all of a sudden we're seeing people pushed out onto the street, which is really sad. But it's a new population we're working with. Yes?
Hi.
Hi.
So first of all, I want to thank you for presenting your really good. So if the supply of housing is up, why don't we help developers build more housing to increase the supply?
Yeah.
For example, permits alone here is ridiculous. It really is. And prevent people from building.
Yep.
Right.
Yep.
We agree.
We don't disagree. I think it's an issue that I know our Board of Supervisors struggles with right now. They've actually convened a housing task force, and about half of the task force are people that are low-income housing advocates, nonprofit safety net providers, and the other half are contractors and realtors. And I can't say anyone's found the perfect solution yet, but it is very expensive to build in California. I mean, when we're in the housing market trying to buy units now, and to give you a rough idea, you know, we're paying between $100,000 and $150,000 per bedroom. And we could buy a 6-bedroom house in Iowa for $150,000 or less. And so it really exacerbates the issue. But, you know, why aren't people helping developers build? Well, we are. I mean, For example, that project for Mercy Housing that we're trying to get built, 79 units, government is going to be giving the land away. They're going to be waiving all the connection fees. We brought grant money to the table of over $2 million, and then we're going to subsidize 20 of the units. And so, it's a multi-million-dollar investment that we're essentially gifting to Mercy Housing as an incentive for them to actually come in and build housing. And that's what it takes to pencil out these days because it's so expensive. So you're right.
So the Placer County, Placer Community Foundation, they've actually taken on housing as an initiative, and so they're doing a lot of educational forums. What is the demographics of Placer County, and what do we need to build affordable housing? And some of that is changing our in lieu fees, doing a variety of governmental or systematic changes to make housing more affordable to build.
My other concern would be, there have been cases where subsidies, although they sound great, they actually increase the market prices of items. Like,
Well, yeah, a HUD subsidy, HUD determines how much we can pay for a unit. What's the top rate the unit you go for? So if a one bedroom is $900, what you find is, and then HUD will say you can't get a unit more than that, and then the client will pay 30 to 40% of their income towards the unit, and then the subsidy does the rest. Well, here in Placer County, I can tell you, it's very rare that you can find a market unit for $900.
Yeah.
They're going for $1,000 to $1,500. So we can't even use our subsidies in some of the places because they go above HUD's fair market rate.
So as an example, last year, the housing authorities around the state, they essentially, for people that are eligible, they will give them the equivalent of a voucher, and they tell individuals, go out and find an apartment you want to live in that you can afford. This is the maximum we can pay. And I'll give you, for example, I used to live in Alameda County, but Oakland has one of the larger housing authorities. They only were able to lease up 10% of all the vouchers they issued one year. Because the other 91%, people went out and looked for 60 days, couldn't find anybody that would rent to them. They came back and got their voucher renewed for a maximum of a second 60-day period, and went out and every day went and looked, and they couldn't find anybody. And so, HUD really the subsidies play at the very low end of the market, so it's not what's driving the market.
Right.
I think it's more, it's the technology sector, and it's the lack of building for so many years that is coming back to haunt us right now that's driving the increases. So it's a challenge. But it's one, if we don't address at some level, it's not going to get any better. We really have to give it some attention. Governor came out with his May revised budget today at 10:30 a.m. and there's significant money in there to try to address housing issues. So I haven't looked at all the detail, but I welcome all of the ideas that he's bringing to the table, and hopefully we'll make some commitments.
Are you involved in Habitat for Humanity as well? I mean, do they offer any kind of assistance, or are you involved in maybe helping them to be able to isolate particular places where they can actually build houses?
In the past, I've had intersections with Habitat, trying to identify property. I've worked in other counties where the counties actually sold land to Habitat so that they can develop. We've had some Habitat projects here in Placer County, very small. They usually target families, so they're really targeting kind of our CalWorks population, which is great. And we support all of those efforts. Sometimes the support, though, is more verbal than actual monetary support.
I was wondering if I could ask a question also. I'm thinking that your question is very good, that permits are so expensive and so on. I was just listening to NPR just recently where, or maybe it was just yesterday, they were talking about the permit process to rebuild for the campfire up in Paradise and all of that. And so they're trying to get waivers on permits and this and that. But I'm also thinking that there is a general public perception that is a NIMBY perception. We don't want those units in our neighborhoods. So there's this there's a public pushback for low-income housing, low-income apartments, and even students. And so don't want students in my neighborhood, don't want impoverished people. So I think this is a realistic rub, and it's kind of human nature.
Well, it's difficult. You could see it in Rocklin a number of years ago when a provider came in with a proposal to build a psychiatric health facility. And the reality is there's one psychiatric health facility in all Placer County. We run it, 16 beds. How many people from Placer County go to a psychiatric health facility every night? I can tell you it's a lot more than 16 beds. And so where do people go? They go to units in Sacramento, they go to the Bay Area, they go to Bakersfield, they go to Redding. And so they came up with a proposal, and they wanted to build something in Placer County to mainly serve Placer County individuals. But the community wasn't very excited about that project, and they were fearful of it, and they thought it was going to lower public safety. They thought it was going to lower property values. And at the end of the day, the developer pulled out. And so and I'll just give you my own personal perspective. I think we all need to carry part of the load. And I find, we are one of the wealthier counties in California. We're very fortunate. But we sometimes send some of our most problematic folks to other counties because we don't have those facilities. We have not been able to site them within Placer County. And that's a challenge that's not unique to Placer. It's a challenge that you'll find anywhere you go. But it's something that at some point, if we're really going to get to a solution around some of these issues, we're going to have to tackle it head on. And I think that's what they're trying to do in Sacramento right now. And it's not always a pleasant discussion because it's not a pure discussion. There are impacts. You can't deny the impacts. But at some point you have to address the issue also.
So a lot of people want to come out and advocate, more often than not when they're against something. What we found is that we need a pool of people to come to the table also and advocate for something. People sit back and wait. Somebody else is going to do it. Somebody else is going to do it. Or we'll see what happens. And what we've had to come up against, you get 100 people in the room against, and only 5 that are saying why we should go forward with this thing. So, when coming to the table, it's all of us coming to the table each and every time to say why we need this in our community. Why do we need a homeless shelter? Why do we need to build affordable housing? That's because we all make up our community, from our poorest to our richest. And so we all need to take part in advocating for what we need as a community. Yes.
I wanted to piggyback on Mark's statement about students outside of special programs that may not know how to find resources. We have a new success center on the 4th floor, and we work closely with counselors and our mental health counselors in the health center. So we basically, I've seen handfuls of homeless students that I've worked with counselors on, and our job is to connect the student with all the resources on campus. That basically a formula for that student. Connect them with the counselor, go over their personal academic barriers, and then possibly the health center counseling if they need mental health therapy. So there are things on campus to address those outside of a special population where they have that holistic model. So if you know anyone that needs help or have a friend, I have so many people come through my chair, and you would never know that you don't know what a student's going through. So we have a lot of things. Our facilities in the gym, the homeless students can use for free to shower and bathe and store their items in a locker during the semester if they're enrolled in a unit. So there are a lot of things on campus that students don't know. So.
This is a great community campus.
Yes.
And so, I love Sierra College. I always share that I read a couple of years ago, they rated all the community colleges around the United States. And I think Sierra was the 5th or 6th rated community college in the United States, and it was the highest rated community college in all of California. And so I really appreciate the people that try to build infrastructure here to serve everybody. I think it's a great thing.
So we had a question.
I was just wondering what the name of the bill for the college students were?
The name of the legislation for the Senate bill?
I'll give you my. I will give you my card and I'll find out for you. You could just, and I'll, you can shoot me an email and I'll get you a response.
Other questions? It's amazing how many different programs and how many different things you're doing. Give me a number of full-time individuals working on all of your projects.
Well, in our department, we're 6 divisions, 800 individuals. We run the animal shelter. We run a housing authority. We have homeless programs.
I'm referring to the homeless program.
So homeless programs, we probably, in whole person care, we have about 15 individuals that work. Kathy, your staff, how many do you have?
About 15 for housing and homeless, probably 25 actually.
So we're in that realm of 35 to 40 individuals. But I have to say, we're a very large department. If you asked us what our number 1 priority was, or our number 1 or 2, we would probably say homelessness and mental health. That's where we're spending most of our time.
Right. Amazing. And how many volunteers?
Well, in the
Hundreds and hundreds.
Yeah, in the community, absolutely.
In the community, most definitely.
Yeah. Any other questions? I'd like to thank you two very, very much. You're helping us out and illuminating us, and Hayden is here with EOPS and Trio and other programs. If you're interested in talking with him, Jeff and Kathy have cards and ribbons. If anybody has